What a beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here, when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
Welcome everybody to Live with Dr. Carolyn Dean here on achieveradio.com. Thank you so much for tuning in this evening, this Monday evening, January 15, 2018. We are already off to a ripping start in this year, and we're so happy that you've joined us once again to get as much information as you can and as many good vibes and as much just the homeopathic resonance as you can from our very own Dr. Carolyn Dean. And I was looking at our website earlier, and it just caught my eye. It says Dr. Carolyn Dean is a medical doctor and a naturopath, and I just kind of snorted and laughed because that is the most gross understatement of anything I think I've ever read in my life. I mean, she is so incredible. Yes, she's a medical doctor and a naturopath, but that's the least of our worries. That she is one of the most concerned, committed, straightforward, integrous people I know, and her vision is just pinpoint accurate, and she's non-wavering in her commitment and her willingness to take risks in order to prove her point. And her point is that the body is perfect, and when you give it a handful of building blocks, it will heal itself. The intelligent design of the body, ladies and gentlemen, is what we celebrate here, not the inevitable decline, decay, and defeat of humanity, but the intelligent design of the body and the perfection therein and its compatibility with this biosphere and its willingness to live eternally, its impulse for life. That's what Dr. Carolyn Dean has known for 50 years, and she has not changed nor wavered, and she's not going to start now. I can guarantee you, because she has got the tiger by the tail, and she knows what she's doing, and she is succeeding in bringing relief and prosperity and just in tremendous health to so many people, and vitality and well-being through her formulas and her intellect, her insight, her wisdom, and her intensity. I mean, she's just intense, but gosh, she gets so much done for so many people. We're so happy to have her here this evening. We're just so glad you're here, and I'm so happy to be in the middle, putting you with her and her with you, and running the switchboard and just saying, everybody call in, everybody from around the world, and talk to this wonderful woman and get healed of all that ails you. So welcome this evening. Very much so honored to be with you, as usual, Carolyn. Just my great honor. Welcome again tonight.
Thank you. Oh, wait. Where's my yay? Yeah. Yeah, Ginny, I know. That's just the Trump bonus talking there, isn't it? It's the Trump bonus.
That's right. That's right. That's what it is. No, actually, I mean, I looked at that wonderful testimonial that we got before we came on the show. And I know that this gentleman is going to call in and talk with us tonight. And it just, every day, it just reaffirms what we're doing and what you're doing and what you've contributed and what you're committed to continuing to do. And I get to see you, behind the scenes working your magic with all the people who are important about pulling, these formulas together and keeping them at the forefront of what we do. So, no, that was not the Trump bonus. But I'm very happy with the Trump bonus. Thank you, Carolyn. That was also very generous, too. Oh, wait a minute. Hold on. Let me just say this right here. Yay.
Thank you. I had an awesome morning on my almost 2-hour morning walk. I passed by Polo Beach down here on the hotel strip, and everyone was, for about half a mile, I saw people looking out at this, what looked like a beached whale and paddleboard two paddleboarders nearby, and I thought, oh, my gosh, has anyone called? I immediately thought there was a problem. And when I got to Polo Beach, just, I don't know, 100 yards out, there was this huge whale. And then I asked one of the beach boys who takes care of the chairs in front of Polo Beach, and I said, is there something wrong? Did anyone call in the distress? And he said, no, it's a mother whale who's teaching her baby how to breathe outside the water. So she'll push him up out of the water, and then he or she will drop and then push him up again. And seriously, I got this awesome picture of this event. It's just incredible.
Oh, wow. Wow, yeah. Really?
Yep. Yeah. So this is my life here. It's just amazing what creatures are about and how wonderful it is, and how no, we are never going to get blown up. The world is too precious for that to be allowed to ever happen. So never worry. And what I wanted you to start off with now, Ginny, is any comments you've had on the Doctor to Doctor series, because I've certainly got emails and verbals from people who said they love the Doctor to Doctor series. Please keep it going. So I guess we'll keep it going. What have you heard?
Oh, yes, I agree, and I should have said something earlier, because I think a couple people even texted me tonight, who's going to be on tonight? I'm like, calm down, people. Calm down. Not tonight, not every night, but it will be a continuing series on a monthly basis, and I'm excited about our guest next month. But, yes, everybody loved it, and they had their own experience of really being able to hear what, Dr. Hotze was saying. They appreciated his candor and his passion, and then also how he was able to learn from you and hear some things that he'd never even heard about magnesium before, and they just thought it was a delightful exchange and looking forward to more. So, yes, I think we did good with that one.
Oh, that's great. Yes, I let him definitely take the lead, and I always joke with doctors that I fortunately didn't get to the point where I was killing people and then decided to switch to natural medicine. When I went to medical school, it was with the notion that we should be doing alternatives in natural medicine, and I was learning that while I was doing my medicine. I learned acupuncture in medical school as an elective. And in my third year electives, Bob and I went to California, and I practiced acupuncture at the pain control clinic down in UCLA. It had just opened up, and I had an incredible time. I had 2 months electives. So I've just been so appreciative of alternative medicine and what it allowed me to do. So, yes, I had a great time with Dr. Hotze, and next month we are going to bring on the beloved Dr. David Holt, who will talk about total biology. So get your questions ready. He could talk the whole hour because he has so many stories and he's just so engaging. But I think what we'd love to hear from people is their questions, and then watch how Dr. Hotze applies his wisdom. So I'm definitely looking forward to that. And as Ginny said, we got an awesome testimonial from someone. This gentleman wrote in some words. We won't say them until he comes on. But, let me say about the testimonials that we speak about on the show, and Chad writes about in his email blogs to you all about our products. We're not treating disease. It may seem like we are, but we are absolutely treating the body for its proper structure and function. The body cannot function properly or achieve its function if it does not have minerals and the right building blocks to do so. So that's what we're doing. And if we happen to find that a person having had some sort of misdiagnosis for 20 years, after 1 week of our products, or 2 weeks or a month or 3 months, if they find a reversal, it's not because we're treating disease. It's because we're treating the structure and the function of the body. We're not using esoteric, bizarre supplements. We're just using basic building blocks that our chemist has somehow miraculously been able to make as absorbable as possible. And that's what the body's been missing, the ability to absorb nutrients to the maximum. And when the body is allowed to do that, it will give you a perfect performance. So that's what we're doing. And we'll get to Ginny's blog now. It's pretty straightforward, but there's a lot of individuality of this blog. You can see it at drcarolyndeanlive.com. The title is Having Surgery, How to Prepare for Optimal Recovery. And I've been working on this since I was in practice. I really did have the experience with my patients that they needed less surgery than the average. If they went into surgery, we would book the time for my day off, and I'd go in on surgery with them. They recovered twice or more as fast as anyone else, and it was because they had the nutrients, they had the homeopathy. What we'll do, Ginny, is I'll cut and paste into the show notes, or I'll just allow you to go ahead and cut and paste surgery preparation from the Future Health Now Encyclopedia for people who want those words. It would be good for you to get the Future Health Now Encyclopedia ebook. Actually, there's a Kindle book and there's a PDF ebook. The PDF ebook is updated to 2017. Unfortunately, on Amazon, they somehow still have the 2015 Kindle book. So I'm updating that in the next week. That'll be up there. But you really should have this Future Health Now Encyclopedia in your bookshelf or on your Kindle, because when things come up, you want to know what to do about them. And I guess what frustrates me, I've never seen people rush to the ER or to their doctor faster in the past few years than ever in my career. And it's not good. It's good to get a diagnosis and then you go home and do something natural. But if you go get a diagnosis, get scared into taking the drugs, then you have to overcome the drugs. So if it's something that you can take care of with a homeopathic remedy, and actually one of the blogs I'm going to be talking about today is definitely about the FDA attacking homeopathy. So anyway, dialing back to Having Surgery, How to Prepare for Optimal Recovery, you'll read the blog that Ginny sent out. You may need surgery. You have to get a second opinion. That's what I say at first. You have to prepare your body and your mind for the process. There are tapes that will help you kind of pray or meditate to just let your body know that you'll have an optimal outcome. We do get emails from customers who say, well, I've been told to get this surgery and I'm afraid of it. And just basic surgical intervention. I say to people, look, if you've got something that can be cut out of your body that's otherwise causing you a lot of problems, and you find a good surgeon, and you feel that your body is in good enough shape to withstand the surgery. I know those are a lot of ifs, but reading this section about preparing for surgery is what you really do want to look at. Heaven forbid that you even need surgery. But this is what I'm saying about preparing for surgery, preparing for any sort of emergency, you want to have the first aid at your fingertips. You want to look at this excerpt from Future Health Now Encyclopedia so that you have the resources at hand to take care of you. And you do really have to be aware that you can't just keep fighting allopathic medicine tooth and nail, and then, heaven forbid, if you have an accident, you're forced to go to hospital, and you have such a negative mindset about it. Anywhere you go in your world, you should be in control and know that you're going to have the best experience. And if the experience seems to be negative at first, you know how many times you've had something go wrong, and then after a timing, you'll say to yourself, oh my gosh, I'm so glad that terrible thing happened because I learned so much, or it led to much more positive outcomes. So you have to think of that, sort of before you go down the negative road. I will ask Ginny what she thinks. Is there more I can say about this? Because Ginny, I'm doing this, sending the excerpt because there's a lot of words in this excerpt. There's a lot of information that people could be benefited by. So that's why I'm leaving it to the excerpt. What do you think?
Okay, that's fine. Yep, sounds good. Absolutely. Yep, they can just email us at support and we'll shoot it out to them. No problem.
Okay.
And we had some great testimonials too, Carolyn, right, of people who had amazing results just recently with their surgeries and that kind of thing.
I don't have them written. Do you recall any?
Yeah, I do. The one was from, let's see, hold on, let me just look. One of them was from, I think her name was Sue, I think she's up in Massachusetts. I'm writing to thank you and inform you that over the past 3 years of taking Remag, Remite, and the RNA drops faithfully, certain things have occurred. It has dropped my blood pressure. My cholesterol is at 150, and my good cholesterol is also quite good. That's cute. My eyes have improved over the last 3 years with no signs of macular degeneration, and my general outlook on life is positive. I had hip surgery due to an injury and had no complication, and the recovery was a breeze.
Wow.
Yep. And then we had another person who wrote us about how good they are feeling having used the formulas to recover from radiation treatment. Do you remember that one?
Yes, that's right. Uh-huh.
Yep.
Right.
Yeah. And, let's see. That was thank you for this person wrote us. Thank you for all the wonderful stories of people using Remag and Remite. I am on these products as well. I have been on all of Dr. Carolyn Dean's complement protocol. I am doing very well because Remag and Remite have helped me during my lung surgery for the past 7 months, especially after radiation. I know these products work. They help me with energy. I'm recovering. Thank you so much, Dr. Dean, for your amazing products. Irene.
Yeah, wonderful. Well, there you have it, folks. If you support the structure and function, it will. That's what we're trying to do here. All right. I'll move on to the homeopathic blog. Ginny, is that okay?
Yes, please. Yes.
Right. What I was getting from my sources, it just was all over the media about homeopathy, how the FDA started saying it was going to treat homeopathic remedies like drugs and expect the billion-dollar drug trials. So on January 9th, I wrote, Harassing Homeopathy was my title. And I say, the FDA, like a schoolyard bully, is once again harassing the gentle practice of homeopathy, probably because it's grown into a multi-billion-dollar industry that provides people alternatives to drugs. As the only historian on the scene anymore, I've watched the FDA and Health Canada launch vicious attacks against homeopathy for decades. Now, someone wrote to me, a homeopath, and said, "What do you mean you're the only historian?" And I said, "Well, I'm not just a historian of homeopathy. I've been following acupuncture, naturopathy, everything for 50 years." And then I didn't hear back from her. So I continue. The attacks on homeopathy have to be recycled every 10 years to brainwash a new generation of patients into believing that homeopathy doesn't work. Now, what's interesting about this whole battle between homeopathy and allopathic medicine, it's been on forever. It maybe really the tide was turned in 1918 when there was that horrible influenza epidemic, and I looked it up. And actually, I'm reading a biography of Wyndham Lewis, and they said there were 27 million deaths from the influenza epidemic. 27 million. And that was toward the end of the First World War, the Great War, they call it. And I think people were really devastated by the war. The war itself apparently killed 3 times that amount. I mean, can you imagine? It's horrendous. So anyway, what happened in the influenza epidemic is the people who went to homeopathic hospitals lived. Here's the words. Was homeopathy successful in treating the flu epidemic in 1918? Yes. While the mortality rate of people treated with traditional medicine and drugs was 30%, so 1 out of 3 people died. Those treated by homeopathic physicians had a mortality rate of 1.05%, so 1 out of 100. Of the 1,500 cases reported at the Homeopathic Medical Society in D.C., there were only 15 deaths. Recovery in the National Homeopathic Hospital was 100%, et cetera, et cetera. So this was around the same time that the Flexner report came out. And I reported this in Death by Modern Medicine. The Flexner report sounded the death knell for all medical schools that did not follow the drug-based German model. In one fell swoop, the Carnegie and Rockefeller Foundation stopped funding women's schools, black schools, eclectic schools, and homeopathic schools. This was just another manipulation of fate that helped make us the very sick nation that we are today. Now, what was interesting about this blog about homeopathy and the FDA sounding its death knell again, and it'll probably survive because I know there's a lot of support for homeopathy, and I got a lot of replies and a lot of people saying how important it is to them and how horrible it is that homeopathy is being manipulated. Calling it a drug is just a way of saddling it with so much bureaucracy that people won't use it. On and on. I won't read them all. I have them all listed, but you get my point. People saying it's a vicious attack. Some organizations set up to talk about the need for alternatives, which I've done for 50 years. One actually you might follow. Let me see if I can find it here. It's here we go. Consumersafety.org. Consumersafety.org. And it's hard to find it if you just go to the homepage, but the article that I want you to look at is called Big Pharma, When Wealth Trumps Wellness. And it starts off by giving the amount of drug money. $374 billion were spent on prescription drugs in 2014. And Actually, the article reads like an update of my Death by Modern Medicine book. I think I updated it in 2017, so it's pretty well updated. But they really do cover a lot of information that just should let people know that they need to look at alternatives, that the drug industry definitely wants to make everybody feel that all they need is drugs. All you need is drugs. And as much as they pretend to be against street drugs, the pharmaceutical drugs are probably affecting people in a negative way more than even the street drugs. So go to, or just Google Big Pharma when wealth trumps wellness, consumersafety.org, and read that article. I think, again, the dozens of our emails I got, thank you for stepping in and standing tall in front of the bully, and on and on. And basically it's we just take care of ourselves, take care of each other. We're trying not to make too many waves. I know we've attracted the attention of the FDA recently, and, that can't be helped. And especially when you hear the testimonial of this gentleman that's going to call in, I'd be happy to sit on a, what do they call it, witness stand, and describe how we are basically helping the structure and function of the body to help people live longer and live happier. So I'm going to stop there. We have a lot in the mailbag, but I'm going to ask Jenny if our gentleman with the testimonial has come on the line yet.
Yes, we do have Paul here with us this evening, so we're going to put him on the phone. And I also want to let everybody know that we've got Dr. Dean is going to talk about her keto program and how that's working for her, because we've had some questions about that on the chat line. And also we've got some great customer contributions for recipes for using our products for cooking. So we're not going to miss that information too. So let's put Paul on the phone. And also, if you want to call in and talk with Dr. Dean this evening, 602-666-6027 is the number to call. And then when you get into the show, you hit *5 on your keypad, and *5 is what raises your hand on the board and lets me know you're here. And then I'll take your phone off mute and put you on with Dr. Dean, like I'm doing right now with Paul. Welcome. Good evening, Paul.
Hi. It's an honor to speak to you all. It's been quite an emotional day for me because this all started with me when I was 17 and I had cancer, Hodgkin's disease. I went through radiation. And it turns out it damaged my heart vessels, and 35 years later, at age 52, I ended up in the ER with a blocked, totally clogged arteries. And the last few years, I've struggled with, what the doctors tell me, and because I've been very resistant to get on the drugs and surgery Ferris wheel, because once you get on that Ferris wheel, it's hard to get off it. Mm-hmm. So about 3 months ago, I went to my cardiologist for a checkup and to do an echo stress test. And I didn't like the news. I mean, it seemed like for the last few years, the news was just getting worse and worse about my heart. And this one was particularly tough to take. Because he said that I was on the path towards getting an aortic valve replacement because it was severely calcified. And I had heard of Dr. Dean's book before this, and I actually bought it before that, but I didn't really take it too seriously. And as soon as I left the cardiologist's office, I said, this cannot happen. I am not going to go for any more surgery. I'd already had stents put in. And so I was just determined to find an alternative way. And so I went on the total program, Remag, Remite, Realign, RNA drops. I started in early October, and about a month later, I started to feel different in the gym. I saw my stamina get better, and today my stamina is much better than it was 3 months ago. So today I had an echocardiogram, and the previous echocardiogram showed that I had moderate to severe stenosis. And so today it showed moderate stenosis. And I'm hopeful that, that in 3 or 6 months from now, it'll keep going in the right direction, back to mild. So for me, it was just such a relief to know that these products actually are helping, like Carolyn is saying about the building blocks, that they're actually building the building blocks for me and for my heart to heal itself gradually. So it's been just such a relief. Thank you, Dr. Dean.
Oh, you're welcome. You're so welcome, Paul. And you said you had the blocked arteries age 52. How old are you now?
54.
So that was 2 years ago. So they've been following you for 2 years. So I expect the doctors today with the echo thought that you'd be severe and then you'd be forced to get surgery. Yeah.
Right.
Yeah.
Well, back in October when I talked to my cardiologist at Cleveland Clinic, we were already talking about going to an interventionist for a consult this month. And as I saw progress in taking your products, I decided to just go to my primary care doctor here in Jacksonville and take the echocardiogram and see if there was measurable progress in my heart, through the echo. And I was relieved to find out that everything had stabilized and not gotten worse. And so I'm going to go see my cardiologist soon, but at least I know that the bleeding has stopped and that I'm not on a kamikaze trip down to getting an aortic valve replacement, which is the last thing I wanted to do. So anyway, so far so good.
Right, and that was smart, Paul, and it's part of what I talk about in the surgery preparation is you get your ammunition because you know that a doctor who does surgery is going to say, well, even though it looks better, you still should have surgery. A primary care won't do that necessarily because they don't, they're not going to cut you. And you really have to kind of gird your loins when you go to these doctors. You have to know kind of what their mindset is. This comes up a lot, or used to come up a lot with me in primary practice with women who'd have breast lumps or breast calcifications. Even in terms of the heart as well, they just think, the doctors just think there's a certain trajectory that you're going to be on and it's inevitable that you'll have surgery. They have never come across cases where people get better from this. There are no drugs for treating calcification. And I'm not saying at all that Remag is a drug. As I led up to this, and Paul already mentioned, I'm talking about the structure and function of the minerals in the body in the right places. Calcium has gotten into the wrong place. And I didn't know your history, Paul, but certainly the having Hodgkin's, there's a lot of lymphatic lymph nodes around the chest that if they do radiation and if you have chemo, that can affect the heart and the lungs. So you had actual damage, and even with that actual damage, allowing the calcification, it's just the calcification that we're treating. And there could be more. There really could be more happening. I suppose down the road, another 10 years, when we can do studies on the RNA drops, for example, maybe we'll find out that that the RNA drops are making the perfect cells that will heal deep damage, because the body has a blueprint of perfection, and we're just supporting that. And that's where you're at. You're in the middle of reestablishing a new body, a new heart, new everything. And to have this happen within 3 months, that's incredible. It's just awesome. So good for you.
Well, I have a question for you about Realign, which is, I've been on it 3 months, and you think I should stick with it? I mean, obviously I'm going to stick with Remag and Remite,
right.
But do you think Realign is something I should take?
Absolutely, because actually I'm in the middle of writing a booklet on Realign to describe it more fully for people. Every day we're faced with toxins in water, in our food, in our mindset. It's just negative stress that we put on ourselves or is put on us. You get a faulty alert that a nuclear attack is about to happen. What does that do to your adrenal glands? So all that stuff the body has to deal with, and the magnesium can deal with that. Don't get me wrong, magnesium is going to be very helpful, but what if you want your magnesium to be dealing with your blood pressure or your heart or your migraines or everything else? So the Realign really helps support the natural detoxification process of the body. And the B vitamins, the methylated Bs and the natural Bs support the immune system and the nervous system and everything else. So it's definitely important to keep up your Realign. You're probably not drinking alcohol, but it will detox your alcohol too. It'll help your liver detox alcohol by supporting the alcohol dehydrogenase enzymes.
I'm not drinking alcohol. Now the RNA drops, help me understand what that does, because I haven't quite figured out the significance of it.
Well, here's where I pull Ginny into the picture because, just for a number of reasons. Ginny, can you help Paul out with the RNA drop discussion?
Yeah. There's a couple things I will say, Paul. Back in the day when we first started working with the RNA drops, which was back in 2010, and 2011 and 2012, we didn't introduce the Remag until, I think, 2012-ish. And so for that first year and a half or so, all we had were the drops. And we had people with very serious heart function issues who were very tremendously benefited by the drops. And one of the things that we started to wonder about with them is how their structure of the biological sugars that are harvested through this barley. So it's a germinated barley product. There are biological sugars, phytonutrients, glyconutrients, all these tremendous things that are coming from that process. And there's also lysine in it. They've got a pre and a probiotic effect. And then they've got the woo-woo portion of the program, which is actually the harmonic in it, the resonance that you would have, like, say, with homeopathy. All these factors combined started really powerfully impacting people's hearts. So we think it's a combination of the way that the sugar, what we call a super sugar in the RNA drops, is set up. It actually strengthens the magnetic field around the heart, and it actually strengthens the cells of the muscles. So we've got that going for it. And then the other thing about the RNA drops is we know that they have a way of removing out-of-balance stressors in the body. And we saw this through the Zyto machine. The drops have been tested on it many times. And they just have a way of balancing things. And with that balance, a lot of time comes relaxation. As a matter of fact, the drops were originally called the Relax and Allow drops. So we feel that they calm people down, kind of relax them, and then those biological sugars get in those cells and actually allow for replicating those cells more perfectly and enhancing that cell performance. So they are, that pico nano size, similar to the Remag, and they've done tremendously well for people with heart issues. Always have.
That's great. Yeah, I love the product. Under my tongue and just squirt a few drops under my tongue and then swish it around my mouth. I'm not sure if I'm doing it right.
Yeah, that's exactly how you do it. Just we ask people to build their dose like we do with the other things, but just the droppers, hold it under your tongue, swish it around in your mouth. People who use the drops typically do not have a lot of dental issues. We've gotten a lot of reports because the drops do work in the saliva of the mouth, and they have a tendency to help with plaque. Like, nobody in my family has to have any kind of plaque issues dealt with the dentist or anything else like that. Hot pockets, gum problems, abscesses, infections, those kinds of things in the mouth just disappear. And then it moves through the lymphatic system, through the saliva, and just kind of moves in through there and just starts doing its magic. And you're doing it absolutely perfectly.
Okay, great. Thank you so much, Jenny, and thank you, Dr. Dean. And I'll give you a progress report next time I have my next echocardiogram, and hopefully it'll show going from moderate back to mild stenosis.
Right, and I don't know how you're using the Remag, but did you get a hold of the Remag lotion, Paul, to kind of rub it on your chest?
Oh, I'm so glad you mentioned that. Absolutely. I use the Remag lotion every day, rub it around my chest right in the heart area, and obviously I use the Remag liquid, and so I use them both every day. Yeah, because, that, even just the action of doing that, just loving your heart and rubbing it, but it's also going to get into whatever scar tissue is surrounding the area, as well as being absorbed and dissolving the calcium in areas where it isn't supposed to be. That's what's happening. Is calcium is very insoluble, but magnesium can dissolve calcium. And people say, "Oh, but my bones will go soft." No, magnesium helps the calcium, once it dissolves it, to go into your bones and go into your teeth. So people will find, if they're doing their Remag in order to dissolve calcification, their bones and teeth will actually get stronger. I mean, this is what's incredible about the body if you're making it work properly. So, Paul, thank you so much. Awesome information. Thank you. Thanks once again for being a great customer and for your body responding so brilliantly. Well, thank you, and I'll look forward to talking with you again next time with my progress with my heart.
Very good. Okay,
Just
Paul,
wonderful.
Take care. Bye-bye. Yeah.
Thank you,
Bye-bye.
Paul.
Thank you, Jenny.
Yay. How about a yay?
Oh, my gosh. Wait a minute. Wait. Wait. Ow.
Oh,
Gosh,
man.
isn't that just the best, Lord?
Yeah. I mean, look what he went through. From age 17, He's been dealing with all these things, and what would have happened if he'd been taking the complete formulas around the time he had to get treatment for Hodgkin's? I would never tell people not to get treatment for their cancer, but the recovery from it, supporting the structure and function of the body after having those surgeries or chemo or radiation, I think that's another place where the formulas would be so powerful.
Absolutely, absolutely. I mean, and we've known that, for a long time. And like you said, I think it's just the constantly getting the word out that these products do support the structure and the function of the cells. And I was impressed again, Carolyn, by something that I read from one of our people, a chemist, who said, our goal, it's not enough to get the magnesium into the bloodstream. We want to get it into the cells. And I just have to, keep reminding our customers that the cell is the target for our products. Each individual cell, there is a biological pattern in there that requires the things that our products offer. And each cell can take them up and use them to their own integrity in their own way, and the body can manage the process. So, it was funny when we heard Dr. Hotze last week saying, I take so many supplements, and you're like, well, I take 5 or maybe 7 or something. Yeah. Because they're the way they're directed by the body. It's just incredible.
Yeah, and they're working when you feel them and you look at your other supplements and you think, I think I'm just taking these on faith. I don't feel a darn thing. And unfortunately, that's the way most online health stores put it to you, that, well, you may need these 100 things. Seriously, I'm shocked sometimes when I see the number of products that people are selling. How crazy is that to have a warehouse with 100 products? It boggles me.
Yeah, it's not good. Now, let me just also say, Jesse in Oakland, yes, I did get your email question, and yes, I think it would be wonderful if you called in and talked to Carolyn, because then that way you can have the connection with her, and then that will help you even more. You'll be amazed. So, yes, please call in 602-666-6027, and if I don't hear from you in a little bit, I'll read your question, but it would be better if you called. And then also, Carolyn, Shelley, she's so sweet. Hi, Dr. Dean and Jenny. Any chance you might be considering making a Remite lotion? Since I've been slathering my whole family with Remag and no one is complaining, I was just wondering if there was something in the works so I could get all the rest of the minerals into them.
Wow. Have we even thought about that?
No, we have not. No, we have not thought about a Remite lotion. We've just been thinking about Remag lotion. Remag lotion on the brain. We can't keep our Remag lotion in stock. It's very popular. It is. But I don't know. What do you think?
Well, I can't see a problem with it. Chemically, it might fall out of solution. Okay, we'll start experimenting with it.
Okay, very good.
Thanks,
and in the meantime, yes, Shelley, thank you for another thing for us to do. But here's another thing, Shelley. Just also know that you can use it topically. Anyway, Remite. It's just like Remag. And, if you run out of the Remag lotion, you can always use the liquid. But you can definitely use Remite topically. And so same principle applies. You can put it in a spray bottle, spray it on the skin, and then maybe rub a little Remag lotion over the area and help that go in even better. So, but I mean, it'll go in on its own actually. But yeah, you can use it topically. Carolyn Howard in Augusta, Kansas wrote in tonight, and he says, I've ordered the Remag, and when I start it, and he says, when I start taking it, I'm also taking these meds. Will it try to compete with the medicines I'm taking, Ativan and Remeron? And he says he wants to not have to take those anymore.
Remeron, M-E, how do you spell it? R-E, how do you spell it?
R-E-M-E-R-O-N.
An antidepressant, that's a new one. And Ativan, anti-anxiety. Well, what we know about Remag and magnesium in general, it's a food, and the body needs the food sources of magnesium. We're not getting it. And we've found, and you'll read online that there are no drug contraindications to taking dietary supplement magnesium. If you do come across things that, you can't take this, they're talking about magnesium used as a laxative or magnesium used as a purge, that they don't want you to take a high dose magnesium and kind of purge out your medications. So as far as we've ever been able to tell, there's no contraindication to taking Remag or any of our products with your medications, and that makes it really fantastic, actually, because we're not putting down drugs in that sense. We're not telling you that you have to get off your drugs in order to use our stuff, or making a yes/no sort of declaration. You can do whatever you want, and what will happen over time is, as you're feeling better because your anxiety or depression are related to magnesium and mineral deficiencies, you'll feel better and you won't have the need for the medications. And that's not us treating a disease or trying to get you off your meds. It's just your body's structure and function improving to the extent that your misdiagnosis is going away. That's a good statement. Your misdiagnosis is going away.
Yeah, excellent statement. That's exactly right. Mm-hmm. Wonderful. Okay, Carolyn, let's talk to Jessie, and we're going to try to grab her before the top of the hour, 650. Jessie, you here?
This is I. This is Jessie.
All right,
my
love. Go ahead, please. Yep, we can.
Big guy.
Start talking,
Jessie. What's that?
Okay, go ahead.
I should point out I'm actually a guy, just to point that out. And my mom is actually Allison Sesko. I think she's called in before.
Hi, Jessie.
Hi there.
Oh,
yeah. So.
Oh, good to hear from you.
Yeah. This is my first time ever listening to the live recording, and it's very cool to call in. It came into my inbox kind of like a act of the universe, because I am looking at potentially getting jaw surgery to correct an occlusion, an open bite that I've had pretty much my whole life. And it came up because I started having some pain in the back of my teeth. I've had crowns back there before. I've never really had any pain until recently. And then when I followed up with my dentist, it turned into a whole kind of cascade of, maybe the actual thing is that there's too much pressure due to your open bite, and that turned into other consults, and now they're offering me a surgical package to correct my open bite and hopefully ensure no pain in the future now that some pain has started to happen. And I'm both, I feel like I come from my mom's side where it's very homeopathic and my dad's side where it's very allopathic. And so I'm a little split on what to do, but I'm hearing out all my options. And it just, when I saw your topic today was surgery, I couldn't help but want to call in and kind of get some thoughts about one, this isn't totally an elective surgery, but it's not a dire, life-threatening surgery either. But it may be something that will, sounds pretty cool to maybe have all my teeth meet, as it were. So.
Right. So is it, they call it, there's an anterior open bite or a posterior, or there are others, but what are your front teeth failing to touch and overlapping?
Correct. Currently only my molar 1 and molar 2, top and bottom, both sides meet. After that, it's open. And, I think dentists have been surprised my whole life that I've never had any pain before. I think I'm a pretty positive person, so I think I've never even thought it could be a thing ever.
Right. Has anyone ever tried to file any of your teeth?
Interestingly enough, the issue that brought me in, which was some sensitivity in the back right molar 2, recently on a second consultation with my dentist, he filed down a crown I have there a little bit, and it seems to have relieved a bunch of the sensitivity. So we may very well have walked into, this isn't at least imminently necessary, but it did alert me to the fact that I have cracked teeth before, assumingly because of this pressure. The fact that only those teeth meet. So,
Okay. How old are you, Jess? Mm-hmm.
I'm 35.
Go ahead. Right. So you actually just continue that thought?
I'm 35, and it was 3 years ago that I had these crowns go in. So up until that point, amidst my open bite being whatever it is, I've never had any issues. So.
Got it. So 3 years ago, were you under more stress?
Definitely.
What I'm getting at is your body adapts to whatever. I mean, whatever you were born with, your body can adapt. But then something like the overbite, you start putting stress in the body, the jaw muscles will start tightening up and start creating a problem. So,
okay, Carolyn, sorry, I have to interrupt. We're going to go to the top of the hour. So let's, Jesse, hang on, and we'll just cross over and be right back. Hang on.
I'll stand by. Thank you guys so much.
Okay, Jesse, great. Awesome.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
AchieveRadio.com. What a beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
All right, everybody, welcome back. Hour 2, Live with Dr. Carolyn Dean here on AchieveRadio.com. And we're joined not only with Dr. Dean, but her caller from Hour 1, Rollover, Jesse, is on the phone with us. So I'm going to let you guys take it away. Go ahead, please.
Yeah, Jesse, this is a great question, and as I was saying at the break, when a person is under stress, you said the stress was whatever it was from, but your stress got worse 3 years ago when you started to crack your crowns. And I'm saying, see, the jaw muscle is the strongest muscle in the body. Okay. And what happens when they're called the masseters, if you want to look them up, and if they start getting tight, I mean, sometimes you've seen this in movies or whatever, where a guy just clenching his teeth and those muscles just pop out. And so I'm looking at that as the why. Like, why all of a sudden it's 32 years after, well, you didn't develop your teeth right away, but here you are for decades and you're fine, and then why? Because I will tell you clear and plain that to be cutting into your jaw and your teeth and even filing, you can cause such irreparable damage. And I don't usually get negative about this, but I know your mom. We've heard about you for years, and I'm going to be real plain about this. You want to do everything. Yeah, you want to do everything besides doing surgery or before doing surgery, because they're happy to do surgery, but they will not take responsibility if it doesn't work. And the other thing I would be doing, because of the stress 3 years ago, you want to look at the total biology of the teeth, because the teeth are to grab and to hold. The teeth, the upper teeth, they grab and they hold on to something. If at the time you were having your stress, what you were trying to grab onto, you weren't able to hold on to, then the whole area around the teeth is going to have repercussions. So I would like you to have a discussion with our friend Dr. David Holt, our little biologist.
It's funny you should mention that, because I have had a consultation with Dr. Holt about a month ago, and it was great. So I will be, and I think I'm going to continue on with him as well. And I think what's interesting is I have a lot of interesting correlations with the number 3 in my life. So that was 3 years ago that happened. And then, here we are 3 years later, and last fall I was definitely experiencing more stress, and I can definitely think of things I was trying to hold on to but couldn't grasp. And lo and behold, this pain starts again. And I try to be I try to listen to my body right away. When something's, when I don't feel good, I know, source-wise that's my body calling to me, hey, something needs to stop or change, even if it's just my mind. So I jumped on this, and it kind of I got whisked away into this whole, well, let's not treat the symptom of your tooth feeling sensitive. Let's realize that down the road, this is going to be a bigger problem. So you should be realigning your teeth and going from there. And I think part of what's happened in the last few months while I've been going to these doctors is I've been thinking, gosh, is there something wrong with my bite? Is it bad that I have an open bite? Is it unhealthy? Is it unhealthy? So
right.
I think that's
I mean, you're a perfectly healthy, bright young man who your teeth haven't been a problem for 32 years. Why all of a sudden are they such a disaster that you have to have surgery? This is dentist talking, and if you start saying to them, well, what is your success rate? How many people aren't helped? And will you sign a legal affidavit that if I have side effects, you'll pay for them for the rest of my life? That usually gets them. But
I think it's
you're right. Yeah. So get the Remag lotion, steal some from your mom, and start massaging your jaws and your face with the Remag lotion, and work on relaxing that whole area, and just letting your body kind of take care of it rather than forcing a surgical issue, because they really don't know what they're doing when they do that type of bite surgery. I guess I've had some really bad experiences with my patients around this, so
that's why I'm checking. That's why I'm checking in. It sounded off an alarm in me a little bit, like, you know what? I'm not worried, but I'm not totally sold on this. So this is good. This is nice to hear. As somebody who's been doing the RNA reset stuff since January of last year, I have definitely noticed just every other aspect of my life. I feel so much more energy. I just feel great in my body. So this was interesting. So I will definitely add the lotion to my ritual. And I was curious, too. I was taking the Recalcia for a while, or the Recalc, however you say it. And I don't know whether it was a reaction in my mind or not, but my teeth started to feel a little funny at one point, so I stopped taking it. I don't know if there's any thoughts on that at all.
Well, that's interesting because it may be that what's happened with your teeth is that there is some calcification around the muscles and the ligaments that hold your teeth, etc. So that calcification might have been aggravated by taking Recalcia, whereas what your body wants to do is dissolve that calcification, which is what you're going to be extending with the focus of your magnesium with the Remag lotion by getting right at that area of possible calcification. Kind of wordy. I'm sorry. I'm very excited about what your question is, Jesse, because I can see you doing just fine without surgery.
Yeah, that's what I'm starting to feel too. One more question to that end. I've also been offered as a part of this surgery package a year of orthodontia, the surgery, and then more orthodontia. Do you have thoughts on orthodontia at all?
Well, and that's the braces and all the rest of it. What you've become to them is a structural puppet where they're going to try to mold your face and your teeth and your jaw into something that they think works for you. But when your mouth and teeth and jaw have been a certain way for 32 years, they know it's going to take a year to try to beat your mouth into shape. And it's painful. I don't recommend it. Saying we'll give you free orthodontia, they know that they're going to have a big problem trying to force your structure into what cosmetically they think is what they would do, but they don't know your body. Only your body. Right. Only you know your body and your teeth and your jaw. Yeah. Right. Wow.
Well, this is great. I really am grateful. Thank you so much for taking the time here, and I love that I will continue on with Dr. Holt and continue on with my RNA. So this is great.
Okay, yes. And give your mom a hug for us, okay?
I will. I just texted her to let her know she's going to laugh when she knows that I did this, and she wasn't listening. She's going to think that's too much. So it's great.
I think she'll love it. Okay, Jesse, thanks for calling in. Great.
Thanks, Ginny.
Okay.
Thank you, Jesse. Thank you so much. That's wonderful. Excellent.
Oh, yeah.
Okay.
Awesome. Let me say this. Bob brought this up at the break because he'd been having a conversation with Deb West the other day. And she brought up two things. First of all, that her butcher that cuts up meat for her, had such bad rheumatism, arthritis in his hands, he was having to give up his shop. And she marched in one day, plunked down a bottle of Remag and said, "You start taking this." And I think it was 2 weeks later, she went in and he just, huge guy, runs over, sweeps her up and just thanks her for the miracle of having his hands back.
Mm.
And the second story was that Deb has been putting Renew lotion around her closed eyes. She closed her eyes and was, just dabbing Remag lotion, not so it'll get inside the eye, but just on the outside of the eye, very deliberately for a long time. And her recent eye checkup showed she had 20/20 vision.
Very cool. Very cool.
Yeah.
Very cool. Yeah.
So I'm going to start doing that.
Yeah, I think that sounds like a great idea. Absolutely.
Mm-hmm. Mm-hmm. And then over to you. Yes, chat, phone calls, whatever you got. Give me all you got.
Okay. Give me all you got. Okay, excellent. Okay, I think we're caught up on the chat line, and let's see where we're at. 602-666-6027. If you want to talk to Dr. Dean, you've got to hit *5 on your keypad, and that's going to raise your hand in the studio and let me know you have a question or comment. Otherwise, I don't have any way of putting you on the phone with her. So you've got to hit *5 on your phone, and I don't have anybody raising *5, hitting *5 right this second. So how about if we do some mailbag? Wait. Okay, wait a minute. I do have a caller, and also let me just say this. Don't forget, after this call, we've got to talk about where you're at with your keto thing, your keto diet.
Okay. Mm-hmm.
All right, so let's go to area code 818-818, California. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, my name is Amy Allen, and my question is, I just recently purchased the Remag and the Remite. Does it work the same for a hyperthyroid? I have hyperthyroid with nodules, and one of the nodules has gone a little bit rogue.
I do have a section. Now, I got your last name, Allen. What's your first name?
Amy.
Oh, Amy. Have you read my Reset Your Thyroid book, Amy?
No, I have not.
Right. I go into detail there. Hyperthyroid, it's kind of rare, and I really haven't had that many cases throughout my practice or with our customers. So I put in the book some information from some other thyroid doctors to help support the body if it's hyperthyroid. It's kind of similar to hypothyroid, but not. So it's a little bit detailed. I don't want to talk about it. I'd have to go to my book and read it out. So rather than do that, I'll just have you read the book, go to the section on hyperthyroid, and see what you think. Because, what some people will say about the Remite, it has iodine in it. And in hyperthyroid, they say, well, you shouldn't take iodine. In fact, there are some people who are developing hyperthyroid from high-dose iodine therapy. That seems to be the rage. And because their iodine is so necessary for the thyroid, and it triggers off the cascade that makes the thyroid hormones, I know everybody does need some iodine. But what happens with the Remite is if it has the selenium in it that helps keep the iodine from being too activating for the thyroid. So you have to read all that and see what you think. Some people will spray the Remite on their thyroid, either hyper or hypothyroid. Let me just ask a couple questions. How old are you?
43.
And why do you think you got hyperthyroid?
That's the big question. No one has been able to give me an answer as to why the nodules started growing to begin with.
Right. Are you familiar with me talking about total biology?
No.
Total biology is the conflict basis of disease. Like if there are certain conflicts that the body and the mind has, the mind can put the conflict into the physical body to try to solve the conflict. So with hyperthyroid, the conflict is not being fast enough to get what you need, so you speed things up for yourself. It can also be inability to spit something out. You have to be quick, more effective, and faster in order to survive. These are notes from my total biology courses. Immigrants who need to work harder and work more than others just to get by, to never enough, pushing constantly. So,
that's my personality completely.
Well, so, it's possible that just your personality caught up with your thyroid where It just tells your thyroid, look, you gotta speed it up. Let's go, girl. And then your thyroid hormones will start pushing. You'll start popping nodules so that you'll make more thyroid hormone. It can be, I'm not going to say as simple as that, but that can be the push that your body is feeling, because it does have to come from somewhere. And when doctors say, oh, we don't know why, but just take this drug. Now,
exactly.
What I said to Jesse, and his mom, and he obviously know about total biology, and he's already talked to our Dr. Holt. If it's something that you want to delve into a little, you could have a telephone consultation with Dr. Holt to get some more levels of information on this. I don't know, how serious is your hyperthyroidism?
Well, it's pretty bad considering I haven't. Well, I mean, I've definitely done a 180-degree circle, considering I used to drink like a 6-pack of Mountain Dew a day, and I ate sugar all day long. And, I've been a female that has been on birth control and had a shot given to her to help with endometriosis. And so I've done, like, the gamut of unhealthy things have been done. And I've definitely changed that cycle drastically, but even with changing it drastically, the nodules are still growing. Now, could I be 100% on board with a healthy journey? No, I have not yet. So,
Well, it's hard because you don't have an indication that being 100% is going to fix everything. So you're still in the searching stage, searching for answers. And what we're saying today is read my thyroid book. That will give you the basics of how the thyroid works, and you don't wait to go to drugs. You do the minerals that support the thyroid. There's 9 minerals that you need to make thyroid hormones. You'll look into Dr. Holt. You'll maybe search the radio show archives. Just type in thyroid and see what I've talked about in the past about it. So you'll do your research, and as I said, about the hyperthyroid conflict, if that makes sense to you, then you'll just sort of take a step back and say, well, no, I don't have to be Energizer Bunny anymore if it's going to be my internal organs. What's the point? So you've got resources which will give you some hope, and you'll just grow your own healing. That's what you're going to do.
Exactly. Thank you so much.
You're welcome. Yeah, great question. Thanks a lot, Amy.
Thank you.
Okay, very good. Thank you so much. That was great.
Well, you can tell. I just seem to be, I don't know. I'm going to start bragging here. I'm going to pull a Bob. But there are people who are open. Jesse was so open to total biology, he'd already had a consultation. And a lot of folks come to us who've been doing some research, and they haven't been getting answers. And that's where I very often turn to total biology to say, well, there's got to be a reason for these things to be happening. Let's just check it out. It's pretty awesome to have the total biology tool.
That was
absolutely.
Like me at all.
Yeah. I mean, that wasn't like Bob at all. Okay, Bob. I'm a modified Bob.
You pulled a Ginny. You pulled a Ginny, not
I
a Bob.
pulled a Ginny. Yeah.
Oh, very good.
Okay, Ginny. Do we? Any more people?
Let me ask this question
Mailbag
here. Yeah, let me get this question from the chat line. My doctor told me that my zinc is low, and he wants me to start taking zinc picolinate 30 to 50 milligrams a day. Should I add this along with the Remag, Remite, Realign, and RNA drops I am currently taking? Thank you.
That's a lot of zinc. That's going to throw a lot of other minerals out of balance. How much Remite are you taking? It might be a better option to increase your Remite to 2 teaspoons a day to get some zinc. And what kind of zinc test was it, et cetera, et cetera. So it's hard for me to know exactly what's going on. I don't know the sex or the age or anything else about the person, but as doctors start getting into doing sort of nutritional testing on people, and they pull, the rabbit out of the bag or the hat and say, well, this is low, you better take a lot of it. I mean, the RDA of zinc is like a couple of milligrams a day. Why would you take 50? It's going to be harder and harder, as I said, to advise people when doctors get out there and start giving, for example, 50,000 units of vitamin D when all they really need is maybe 1,000. So I would be increasing my Remite. So there.
Very good. Excellent. And Joy, if you have any more questions about that, call in and talk to Dr. Dean on the show, 602-666-6027. You'll be happy to speak to her, I'm sure. The wealth of good information for you here. Mary typed in, Carolyn, do you have a list of foods we should eat when we start the program?
What's that in our restructure booklet? Would that cover that the best, Ginny? And then
I think.
Yeah, and in a few days when we do our weight loss webinar, and along with that is our Reset Your Ideal Weight. That's our weight loss booklet. So, the restructure booklet for the diet.
Okay. And Mary, that's on drcarolyndeanlive.com. Just go to the books section and you'll see the restructure handout, and there's dietary information in there. Now, what do you want to talk about the keto diet? You want to tell everybody what you got going on with that?
Well, everybody should come on to the webinar. What is it, Thursday the 18th of January? Oh, my gosh. I guess I better get cracking.
I guess that's this week.
Yeah. Yep.
Okay.
It's in 3 days. And basically, I just had such a great time with going into the ketogenic diet where you stop eating carbohydrates to the extent that your body isn't just burning off the carbs and ignoring fat burning. Someone made the statement in something I read that, the body's lazy and it just burns carbs. The body's not lazy, it's efficient. If it has carbs that'll burn quickly, it'll burn carbs. But then if you reduce the carbs and you don't have them to burn, the body will burn fat. So in burning fat, it will take fat out of storage, out of the fat cells, and you'll lose weight. However, if you eat too much fatty foods, you can gain weight just by gaining calories. And I think ancestrally, like in the sense of the paleo diet, the ketogenic diet is a bit like the paleo diet. People did not have all the carbs that we have now back in paleo times. They had some berries. And so they were burning fat most of the time, and they supposedly were maintaining their weight, although they didn't live that long. They lasted into their 30s. So now with all the carbs that we've got everywhere, we're just focused on carbs, and we never get to the fat burning. So, as I said, I've been having a great time working with high-fat foods, lost the weight I wanted to lose. I'm learning how to maintain that. I'm learning now how many carbs I can have and maintain my weight. I went through the holidays, and, I gained 2 pounds, but that as soon as it went back to the keto diet, then I lost those 2 pounds. So it's really nice to be in charge of your weight, and that's the information I'll pass along in the webinar. And if you can't make the exact timing, we'll, of course, have the webinar up on the website. No, we'll have it on YouTube, I guess, and maybe on the drcarolyndeanlive.com. At least the drcarolyndeanlive.com under books, there'll be the free Reset Your Ideal Weight booklet. So there. How's that, Ginny?
Very good. Yep, that's right. You've got a new booklet and the webinar coming up this week, and it's very exciting, very exciting. Yep, lots going on. But, so I hope that answers everybody's questions. The next question is, how do they get into the webinar? And what will happen is Thursday morning, you'll get a link that will come in your email if you're already subscribed to our mailing list. And if you're not, just go on the rnareset.com website and subscribe at the bottom, and you'll be able to get right on there, and we'll send you the link to join us. I want to tell you guys also, too, that last year we had our good friend Sandy, who did tons and tons and tons of great recipes for us with Restructure and the minerals, and we made cookies and we made brownies. Oh my goodness, we made so many things. And but this year, already launching the new year, we have people who have been experimenting with how to incorporate the products into their food and into their soups. People are using them in their soups and all kinds of things. And Cheryl Allen sent me the sweetest email about how to make Restructure frosting. And she puts it on pumpkin muffins. And I thought that sounded so good. And she sent me a picture. And so what she does is she just takes some butter and some honey and some Restructure, and she whips it all together and a dash of sea salt, and she uses it and frosts her pumpkin muffins with it. So while we're talking about diets, we might be talking about the little treats that you give yourself after you've been good on a diet. And that means we can talk
Ginny,
about...
These are called fat bombs. They're perfect. For example, I have someone who's been making Sandy's cookies for me. Rice flour, almond flour, whatever, the baking soda, a couple things.
Yes.
And I just lather it with butter. So I make it into a high-fat snack. And if Cheryl's frosting is butter, and you can use some honey, or you can use stevia if you don't want to have any sugar. And Restructure, it does have fat in it. It has more protein than fat, so that's why you want to have the butter to make it higher in fat, moderate in protein, and low in carbs. That's what you're looking for the ketogenic diet. So it's not even going off your diet.
Oh, wow. Okay. Well, I don't know anything about the ketogenic diet. I've been saving myself to hear about it until we do our webinar. So I'm just I'm a Dr. Dean keto virgin. I know nothing about these things, but if I can have a half a stick of butter and Restructure, I'm on the diet all right now. I'll join. Pick me. That sounds great. So, if you guys are interested in Cheryl's little recipe for the Restructure frosting, just send me an email, frosting recipe, to support@rnareset.com, and I will send it off to you. Okay, wonderful. I'm so excited to know that's on a diet. That makes me happy right there. Okay, and let's see, what else are we doing here? Oh, and then our final thing, and then I'm going to have you do some mailbag. Oh, wait a minute. Do I have other callers? Oh, we've got callers. Goodness gracious. So busy tonight. Carolyn, I've got a caller, but also Claire, our good friend Claire, just made it to the show. She says she's happy to be back, and she said the doctor hour with Dr. Hotze was awesome. So she loved it. There's some feedback for you. Yeah. Mm-hmm. Welcome back, Claire. Glad you came back. Okay. Let's see. 641, the great state of Iowa. Let's go out and talk to area code 641. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, this is Anita checking in from Iowa.
Hi, Anita. Okay, Anita. Go for it.
Sorry, I have been, the holidays you weren't, and I just haven't gotten a chance to check in, but I had been working my way up with Remag and Remite for the heart racing palpitation things. And I worked up to about 4 teaspoons of Remag and 2 teaspoons of Remite before Christmas, and then I was still having some heart stuff going on, and then we traveled on Christmas Day, and we're gone for a week and back on New Year's Day, and I had a lot of issues with digestion, and I was getting kind of frustrated, but I kind of just regrouped, and when I got back, digestion, meaning a lot of stools, I was, in a strange diet and everything, so different for me, like not my own home cooking and stuff. So when I came back, I kind of readjusted and thought I didn't know if maybe some of the minerals were upsetting my stomach. So I backed down to 3.5 teaspoons of Remag and 1.5 of Remite, and I have come to this place in the last, probably since about the 4th of January, where I'm taking 3 3/4 teaspoons of Remag and 1.5 of Remite. And I had almost a week without any real heart episodes and feeling quite good. But then I got some more breakthrough again, like last Friday, with a little more racing. And so I was kind of just wondering, is my body just so deficient that it's taking time to figure it out?
How long have you been taking the formulas, Anita?
I started Remag on the 1st of November, and I started Remite probably about the middle to the 3rd week in November. I will say, though, that the heart stuff is different. I said that originally I could feel the shift, and even now when it happens, it's not, I haven't had any really super intense racing. It's more mild, although I did have some laying in bed, I'd roll over, and it was doing that the last couple of days. But my I had an eye twitch when I first started this, and I was, as you recall, a heavy magnesium user. But the eye twitch has been gone. Like after 2 weeks, I've just been gone. And I had a sore behind my gum that has just shrunk and gone away. I have a kind of a bump on my elbow that must be like a calcification. That seems to be shrinking. So I have other things going on, and honestly have felt quite good since I've been back from that week-long trip. I have felt really quite good.
Anita, I know what you're asking, and I think I can answer it. And you're still in the honeymoon phase. Can we say that? Ginny, can we say that? Honeymoon phase, and you're at the beginning of your treatment. And I give my case of took me a year and a half. And like you, I'd been trying to take magnesium all along, but it wasn't until I got the Remag and it started being absorbed fully. It took me a year and a half where I now have no symptoms. And I used to be on the 4 teaspoons when I added the Remite, because it took us a year to get the Remite after the Remag. And when I put in the Remite, I was down to 3 teaspoons. Now, if I take more than 1 teaspoon a day, I get the laxative effect. So I know I'm saturated. Okay. So you're slowly building up, which is what we want your body to do. Remag and Remite, they're not drugs. They're minerals that your body's replacing. And certainly as you're taking them, they're being utilized. Some of them, we don't know what percentage is going into storage, but some of it. Wow, you're not even into it 3 months, and you've already had.
No. Yeah. Well,
Yeah.
I wondered,
So you're
what does it mean when, though I'm taking it, but then I have like a leg cramp still? Does it mean I need to take more or just be patient? Because when I take more, then I get more. Okay.
No, you don't want to be flipping up and down in it. That's the biggest problem we have with people. That's why we say to slowly build up and stay at a certain point, because what will happen, unless, heaven forbid, a person with our AFib people, they will tell us, they'll have an attack, they'll have some sort of trigger, and then they'll take an extra teaspoon just then, and it'll help get them out of the go back to normal rhythm. But you don't want to be dancing up and down. Just be steady. What's happened when you have a breakthrough symptom, it can be something you didn't even realize that you ate or did or inhaled, or not enough water. You didn't put your sea salt water by your bed to drink it. All kinds of things. And the AFib booklet might be good for you to read. I've
read that. Yeah, I read all of that already. I've been saturating myself with all of your ebooks.
Yeah. So it's just patience. Patience. Allopathic medicine has really done a number on our heads, making us think when we take a pill or a powder that it should work instantaneously, but that's what got us into trouble in the first place.
And I was, my background is homeopathy, and I was getting discouraged, and then I thought to myself, I would be upset with my own clients if they expected this kind of result using something like that. So I'm thinking, I kind of backed off, and then I think the biggest thing I noticed is that my mental shift has been so different, because I feel optimistic about my heart for the first time in probably 10 or 15 years. And that maybe I'll be able to do more. And, I went out at 15 below, it was 25 below wind chill here today. And I went out and was able to shovel and snow blow, and I didn't have any heart episodes while I was doing it, at all. So I thought, okay, I'm optimistic, and that I feel like that makes so much difference in how you feel. Obviously, it does.
Yeah, I have a new file here for the 2018 radio show, so I don't have the one from previously. But yes, thanks for mentioning. And you did mention that you'd been on a ton of other forms of magnesium before, so you thought, well, I must have enough magnesium. And also your background in natural medicine, and I guess it was a real shock to you to realize, well, gosh, I don't even have enough magnesium to stop my eye from twitching, etc. I know. That was
one of my clients threw it in my face. You need magnesium. I go, I take 725 milligrams a day, but it was like, to me, it was like, duh, yeah, I still am getting leg cramps, and I still am having an eye twitch. What is the problem? So. And that stuff is much, that stuff is much better. I guess it's just when it gets into my digestion and starts upsetting that. I was in a vicious cycle when I was gone between Christmas and New Year's, because I was having a lot of stools a day, and I knew then I was losing magnesium. And then I was trying to drink and get my Remag while I was there, but at the same time, you know what I mean? And it was just like, it was hard. It was really a frustrating week for me.
Yeah,
overall.
And I'm sure it was for a lot of people. The holidays are very stressful on many levels, not just not being able to take your supplements, but your diet, just the stress of travel. So I think you did well. You came home, you dug in there, you got back on track, and now you just have to be patient, give yourself more time to heal everything.
So do you feel like if I feel like this is kind of a sweet spot, I should just kind of stay here, less the 3 3/4 and the 1.5 Remite? And I guess my other question that I've had all along too is, do I need to get on the I haven't taken calcium since I had a kidney stone in 2007 or something.
Well, what you do is you look at your diet. Like I say, I have the Remite Recalcium book.
Right.
Look at your diet. If you're getting 600, you're fine. But I would. Do you have any signs of when your calcium is low? Mine is my knees start getting a bit achy. And,
when I was we were visiting family in Colorado, and my knee was giving out a couple times there, and I don't know if this is a calcium thing, but I have ridges on my fingernails. Always, I've had that. I used to be a heavy consumer of dairy, and I stopped that when I realized I was allergic to it. So I don't eat hardly any dairy at all. So anything I get calcium-wise is going to be like broccoli or maybe almonds, almond butter. I crave that, but that's why I just kind of wondered. And I've been shy of it. Obviously, once I had a kidney stone, I was like, no way did I want to have another one of those.
Well,
so that's when I went into the magnesium.
Personally, from what you're telling me, I would be taking 1 teaspoon of the Recalcia. But what you can do is give yourself a couple of weeks on the 3 3/4 and 1 1/2, and make sure you're stable. And then when you start the Recalcia, then you'll see how that makes you feel. Not so much when I take Recalcia, but when I eat a lot of dairy, and I'm eating more dairy, non-lactose dairy, cheeses on the ketogenic diet, I was starting to need a little more magnesium, Remag, because I was getting that much more calcium. So it's a little bit of a back and forth, and I just look at it as an experiment. I don't think it's I think it's fascinating the way my body will respond, and I can track it.
Mhm. Yeah, I agree.
Okay,
it's an
Anita,
amazing thing.
You're okay?
Yeah, and I think so. I don't know if you have any suggestions for people that are saying it tastes terrible, I can't take it. My husband is wrinkling his nose at it. I'm trying to get him on the Remag. So
I know. I mean, we try to get people on the Remag lotion, rubbing that on as a total body moisturizer to get 400 milligrams, and then they only need to take a teaspoon of the oral. So that's been helpful for us.
And what's the ratio like?
200 milligrams in a teaspoon of the Remag lotion.
Okay, because I take that I've used that on my hands and stuff too. In addition.
Okay.
So
yeah, we feel your pain, but it's the people who do take it and feel great with it. They say, well, I can put up with the bitterness, but we understand the Remag lotion will help, and we're working on other solutions as well.
Okay.
Okay?
Thank you so much.
You're welcome. Thanks for calling in and updating. It's great to see your progression.
Yes, I will keep you posted.
Okay, Anita. Take care.
Thank you.
Bye-bye.
Bye.
Hey, all right. Excellent.
I know.
Yeah,
I know.
People kind of complain a little bit about the taste, but we don't let that stop us, do we?
No. Take your medicine and love it. I know. It's like we've sugar-coated our lives so much that we can't stand anything that's off the grid. I do not like the taste, and the way I'm taking mine right now is a half a teaspoon in a shot of about six ounces of water, and I use that to swallow my 3 other supplements. I'm taking my Realign. I do take a Blue Oyster Oil. I do take a Prescript Assist, and 2 of the Grown by Nature vitamin C's. And so I use that water to just swallow my supplements. And then I do that again in the evening at bedtime. I'm not sipping through the day. I don't find I need to do that anymore. So I just chug it down and it's done. And I'll drink a little sea salted water after. And I put it in my sea salted water, and that helps the taste as well.
Yeah, very cool.
Yeah.
Very cool.
Or I don't know if they're putting stevia in it or if there's any way to sweeten it up. I haven't heard what some people are using it in cranberry juice, but just chug it down and be done with it.
Well, just like Claire wrote, she wrote, my daughter hated the taste of Remag for the first week, and then it switched for her, and it began to take sweet, and now she loves it. And that's how I feel. I feel like the water tastes sweet, and if I don't have Remag and Remite in my water, I think it tastes flat and weird. So
right.
I think, it can switch to that sweetness. I think it's very wonderful. So
very good. Okay, well, we'll go there. I'll take more of that.
That's right. I'll take more of that. That's right. All righty. Well, let's do some mailbag, Carolyn. We've only got 12 minutes left in the show, 10:57 and counting. So let's do some mailbag, I guess.
Okay. Every once in a while I go and look at the Amazon reviews. Now, what's frustrating is that people are still buying the old copy of Magnesium Miracle and getting frustrated because it's not the new copy. So crazy Amazon won't ditch the old copy and send it back to the publisher. And there are like 800 reviews on the old copy, and we've only got, 50 or I don't even know how many reviews on the new copy. So it's all crazy. But a woman wrote an Amazon review. Magnesium has changed my life drastically. After being on 5 prescription drugs, antidepressants, anti-anxiety, sleep, muscle relaxants for years, bracket, little did I know they were making my magnesium deficiency worse, bracket, and stopping an active physical lifestyle that included running, volleyball, weight training, biking, etc., I'm now back at the gym after 15 years. I'm much calmer with no heart-thumping palpitations, no anxiety band around my stomach, no muscle spasms, and improved sleep. I'm off all the drugs except one. No conventional MD I have ever seen has given me any relief compared to the benefits of magnesium and other minerals. It is so wonderful to work out with weights, blah, 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 after 15 years. So that was awesome. She said, yes, I have tried different magnesiums, but I found Dr. Dean's Remag and the magnesium lotion is a perfect fit for me. It did take adjustment to work out how much I needed, but I didn't stop. I wanted my old active life back, bad enough to keep experimenting and adjusting dosages. So that's the structure and function of the body. This is not us treating diseases. And people are doing it on their own. We don't hear from most of the people who are taking our products. Right, Ginny?
That's correct, yes. Well, yes, that's right. We don't hear from most of them, right.
Yeah. Another one, thank you for all these wonderful stories of people using Remag, Remite. I'm on these as well. I've been on all of Dr. Dean's complete protocol. I'm doing very well. Yes, this is the one. Remag and Remite have helped during my lung surgery for the past 7 months, especially after my radiation. I know these products work. They help me with energy. Thank you, Dr. Dean. That was pretty awesome. Next one, I'm writing to thank you, inform you that you've already said some of these. Oh, my gosh, I'm sorry to repeat, but hey, let's repeat. I'm writing thank you, inform you that over the past 3 years of taking Remag, Remite, and the RNA drops faithfully, certain things have occurred. It has dropped my blood pressure. My cholesterol is 150. My good cholesterol is quite good. My eyes have improved over the last 3 years with no signs of macular degeneration, and my general outlook on life is positive. I've had the hip surgery due to an injury, and I have had no complications, and the recovery was a breeze. That was awesome. And, that's the person who our Bri-Ion introduced to the products. That was very nice. Thank you, Bri-Ion. Over the past 10 years, I've had my glomerular filtration rate tested, and it's gone down, which means it's gotten worse every year. And I think it's a she said, it's down to 50%. I was getting a little discouraged. Well, I had the test done again 7 months after starting Remag and Remite, and this time I had a 25% improvement to 66%. So she went from 50 to 66%, which is in the normal range. Also in the same period of time, cholesterol dropped 20-plus points. The cardiologist still wanted to put me on cholesterol-lowering medication, which I politely declined. Up until a few weeks ago, I've been unable to lower my high blood pressure. So I backed off on most carbs, and her blood pressure went down, and discontinued a blood pressure medication. And that's important, the sugar effect on people. And then she talked about her AFib. She's still working on that and adjusting her levels. And I think, I wrote her about that she probably needed to take a bit more Remag. And she asked about the calcium as well. So it's like people are fine-tuning. This is what we're seeing, that people now, after a certain amount of use, of timing, of using it, they're fine-tuning, and they're doing it on their own. A customer, well, this used to be a client too. She said, I found a doctor who treats ciprofloxacin toxicity with intravenous ozone. He said the ozone kills bacteria, candida, viruses, etc. In general, the idea is to rejuvenate the mitochondria. As we were talking, he asked me what supplements I took. I told him mainly magnesium. He said, what kind? I told him Remag. And he was so thrilled and said he himself takes Remag, and he has read your book. We were both so excited, and he was impressed that I was taking the good kind of magnesium, LOL. I believe he recommends that ciprotoxicity victims take Remag. It made me so happy. I'm about to order the complement formulas for my father now with type 2 diabetes. Thank you so much. Isn't that awesome? We have doctors out there who are taking Remag.
That's fantastic. That's awesome.
Right.
Interesting, the comments about ozone. That's interesting.
Right. Yeah, that's it's a therapy that has been used over the years and of course ignored, which is very frustrating. I'll read this last one and then we'll just chat up to the hour. I've had a fullness in and behind my eyes, like they were puffy, but and I could not figure out why this was happening. I just thought I was extremely tired. Well, lots of research led me to Remite and the thyroid. After 4 days of taking the Remite, it has totally vanished. There is a type of eye condition where when your thyroid is low, it causes a swelling and pressure behind the eyes, but it's amazing that symptom was gone in 4 days. And so it means it's not so much a thyroid condition as a mineral deficiency condition for which we are treating the structure and function of the body. So there. So just a couple more minutes. Let's just mention again that we know that weight gain, obesity are really rampant in our culture, in anybody who's eating a Western diet. And in my desire to lose a few pounds, I looked into the ketogenic diet, and what I found is when I did the diet, and actually I began it with a few days of fasting and using all the complement formulas, except I did not use Restructure, I did not have any of the keto diet side effects. We'll talk about this in the webinar on Thursday, and you'll have access to the webinar and the booklet to see if this ketogenic diet can help people if they want to have some weight loss. And it just sort of proves our point again that even in weight loss, if you're using the completement formulas, it can support you. I wasn't hungry. I didn't have any of what they say, the keto flu, what happens when you start breaking down fat cells, that the toxins are eliminated. Well, if you're taking your Realign while you're doing the fasting and the keto diet, then your body will detoxify those toxins. So it's pretty fun to know that the completement formulas can be used for everything. And that's what we're encouraging people to do in this, what do I call it, Reset Your Ideal Weight webinar. So that's all I have to say, Ginny. I've talked pretty much nonstop for 2 hours, and I'm going to stop now.
Well, I'm excited about the webinar because I think it's going to be an answer for a lot of people. And what I like about it, too, is going over the intermittent fasting, which is also wonderful. Couple comments from Marv, who just wrote, "Welcome, favorite people. I just received my protein powder today. So happy. My muffins will be healthy in the morning. How can I forget I'm using Remag with my toothpaste? Much credit to beautiful teeth." Wow, that's cool. Remag with your toothpaste. Claire says, "My 40-year-old father with severe dementia took Cipro for a UTI. A week later, his knee hurts and he can walk. He can't walk. Could this be related? My father is given 1 teaspoon of Remag and Remite must be, I should bump it up. Yeah, Claire, bump it up for sure. He's only taking a teaspoon of Remag and Remite after using Cipro. So, yeah, definitely."
Okay, Ginny,
Carolyn.
thank you.
You've been listening to
Great show. Thank you, Bob. Thank you, Bill.
Thanks a lot, Jenny.
Thank you, Bob.
Thanks for all the fish.
Have a wonderful tomorrow.
AchieveRadio.com.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.